That moment when you notice your playful puppy isn't quite putting weight on one leg, or maybe your kitten's front leg has a bit of an odd curve as they stretch.
Yeah,
It's enough to make any pet owner's ears perk up with concern, right?
it certainly is. And that seemingly small observation could actually be the first clue to what we're exploring today. Antebrachial growth deformities in our dogs and cats.
Antebrachial. Okay, let's break that down a bit. We're talking about the forelimbs, specifically those two bones in their lower front arm, the radius and the ulna, correct?
Exactly. Think of this deep dive, which draws from a pretty comprehensive veterinary resource, as your shortcut to understanding these growth-related issues.
Right.
Our mission isn't really to drown you in, medical jargon, but to pull out the essential knowledge. What are these deformities? What causes them? And critically, why catching them early makes such a difference for your pet's well-being.
Okay, sounds good. So, what exactly are antebrachial growth deformities? It sounds, well, more involved than just a simple crooked leg.
You're right, it is.
Yeah.
At its heart, it's an issue with the normal shape of the forelimb and maybe how the elbow or wrist joints line up.
Uh-huh.
This happens because the radius, or the ulna, or sometimes both, don't develop in a typical way as the animal grows.
And why are these two bones, the radius and ulna, particularly susceptible to these kinds of problems?
But what's key to understand is that they're a team. They grow side by side.
Yeah.
So if one of them slows down or stops growing prematurely, it can act like an internal brake,
Ah, okay.
a retarding strap, as the text puts it, on the other one.
Right.
Then the faster growing bone has to compensate somehow. It might twist or curve around the slower one or even kind of overgrow at the joint.
Yeah.
And that leads to the misalignment we mentioned.
That's a great way to visualize it. Like trying to walk with one leg suddenly shorter, things are going to go a bit wonky.
Exactly. Things get wonky.
So, how do these bones normally lengthen? And what specifically disrupts this process in these deformities?
Normally, bone growth, the lengthening part, happens at the growth plates. Vets call them the physis.
Slices.
Right.
It's where new cartilage is constantly being made, and this cartilage then gradually turns into hard bone. That process is called endochondral ossification.
Okay. Cartilage turning to bone.
Yep. And this keeps going until the animal reaches skeletal maturity, and then those growth plates close. Deformities happen when this really carefully timed and balanced process goes, well, off script.
Okay, so what are the main culprits? What throws this growth process out of sync?
Trauma is a big one, probably the most common cause, actually.
Injury.
Yeah, if a growth plate gets damaged, say, through a fracture, the cells responsible for making that new cartilage can be injured, and that can potentially halt growth just in that specific area. What's interesting and kind of tricky is that a certain type of crushing injury to the growth plate, it's called a Salter-Harris type V fracture, might not even be obvious on the first set of x-rays.
Really? So you wouldn't see it right away?
Not necessarily. The limb deformity might only become noticeable weeks or even months later, as the other bone keeps growing normally against the damaged one.
In fact, these kinds of injuries to the antebrachium in growing dogs, might be involved in maybe up to 10% of these growth deformity cases.
That's surprising. So a seemingly minor bump or fall could have these sort of hidden, delayed consequences. What else can cause these issues besides trauma?
Genetics also plays a pretty significant role,
Okay.
especially in certain breeds, the ones we call chondrodysplastic breeds.
Like basset hounds.
Exactly. Basset hounds, Lhasa Apsos. Think of breeds with shorter, often kind of bowed-looking limbs.
Yeah.
In these breeds, the whole process of cartilage turning to bone is inherently a bit different.
Right.
This can lead to the radius and ulna growing at different rates pretty much from the get-go, resulting in limb deformities and often elbow problems too. There's even a specific inherited trait they've identified in Skye Terriers that predisposes them.
So it can literally be in their DNA. What about diet? I feel like I remember hearing something about oversupplementation, especially in large breed puppies.
You're right to bring that up. Nutrition, specifically giving too many supplements, particularly calcium, has been potentially linked to issues. It might cause retarded endochondral ossification in giant breeds.
Meaning the cartilage doesn't turn to bone properly?
Sort of, yeah. You can get these retained cartilaginous cores. However, honestly, with the improvements in commercial pet foods and better nutritional guidelines, this seems to be less common now than it perhaps used to be.
Good to know.
We should probably also briefly mention a couple of other conditions, like osteochondrosis and hypertrophic osteodystrophy, HOD. These can occasionally disrupt bone growth, again, typically in rapidly growing large or giant breed dogs.
Okay. Are there any other, maybe rarer causes we should touch on?
Well, there's a very rare condition called congenital agenesis of the radius.
Agenesis meaning it's missing.
Exactly. Seen mostly in cats, but very occasionally in dogs too, where the radius bone is essentially missing right from birth. As you can imagine, this results in a really significant bowing of the lower front leg and a lot of instability in the wrist joint.
Wow, okay. That's quite a range of potential factors: trauma, genetics, nutrition, these other conditions. Now, thinking as a pet owner, what are the actual signs I might see? What should make me think, maybe I should get this checked out?
Right. So if the cause is trauma, you might notice a gradual change in the ankle of the limb developing, or maybe a new lameness, a limp, that starts maybe 3 or 4 weeks after an injury, even if that initial injury seemed pretty minor at the time.
Okay, that delayed onset again.
Yeah. And for deformities that are more developmental, maybe genetic, you might see a more gradual onset of lameness. It might seem worse after your pet has been playing or running around.
And are there specific signs that might point towards which growth plate is the problem, like the radius versus the ulna?
Yes, definitely. There are some typical patterns vets look for. For instance, if the growth plate at the bottom end of the ulna closes too early,
Okay.
the radius bone, which keeps growing, tends to sort of drift outwards. This causes what we call a valgus deformity.
Valgus. That's angling away from the body.
Correct. The lower part of the leg angles outwards. You might also see a forward bowing of the leg that's called procurvatum, and often the paw tends to twist outwards too, which is supination.
Okay.
The leg might also just look shorter overall, and in some cases the wrist joint, the carpus, or even the elbow joint might partially dislocate or subluxate, which causes pain and lameness. Think of the ulna as an anchor.
Right.
If that anchor stops lengthening too soon, the radius, which is still growing, can kind of veer off course.
That's a really helpful analogy. So what if it's the radial growth plate, the one in the radius that closes early? What does that look like?
Premature closure of a radial growth plate often leads to a more noticeable shortening of the entire forelimb.
Makes sense. The radius is the bigger bone there.
Exactly. Now, if the growth plate at the bottom of the radius closes evenly, all the way across, the leg might actually look relatively straight still. But you might see wider than normal spaces in the wrist or elbow joints on an x-ray, and potentially a backward bowing or recurvatum of both bones. However, if the closure is uneven, say, just on the inner side, the medial side of the radius,
Right.
then you're more likely to see a varus deformity. That's where the lower leg angles inwards, towards the body, sometimes with an inward twisting of the paw.
So the opposite of valgus.
Correct. And if the outer or lateral side closes early, you're more likely to see that outward angulation again, the valgus deformity, and maybe an outward twist.
And what if it's the growth plate higher up near the elbow?
Right. If it's the proximal radial physis, the one at the top of the radius near the elbow, that closes prematurely while the ulna keeps growing. Well, that primarily messes up the elbow joint itself. It leads to a poor fit between the bones there, what we call malarticulation, and often a widened joint space.
So it's definitely a complex puzzle, but there are clues an observant owner might pick up on. I also noticed the text mentioned something about how the length of a dog's legs might influence how these deformities actually present.
That's right. There seems to be a trend. Longer-legged dogs often tend to develop more noticeable changes in the angle of their limbs, the varus or valgus we talked about.
Right.
Whereas shorter-legged breeds, maybe like those chondrodysplastic ones, might show more obvious problems with how their joints align, like elbow subluxation.
Interesting.
Also, this is really important, the earlier in the growth process a growth plate closes prematurely, the more significant the eventual deformity is likely to be, simply because there's more remaining growth potential, more time for the other bone to grow abnormally in relation to one that stopped.
Right, more time for things to go wrong, essentially. Okay, so if a pet owner suspects something isn't right, based on these signs, how is this officially diagnosed? It definitely sounds like a vet needs more than just a quick look.
Oh, absolutely.
Yeah.
A thorough physical exam is always the first step. Feeling the limb, checking range of motion, watching the animal walk. But imaging is crucial. Yes, standard x-rays are the mainstay. But remember what we said earlier, damage to a growth plate from trauma might not show up clearly right away.
Right, the 2-4 week delay.
Exactly. So sometimes repeat x-rays are needed. And it's vital to take detailed images, usually including the entire limb from the elbow down to the toes. And very importantly, comparing it to the opposite, presumably normal limb. That comparison is key.
Why is the comparison so important?
Well, it helps establish what's normal for that specific animal. Vets will carefully measure the lengths of the radius and ulna on both sides and assess how the joints line up the angles, the spacing. This helps pinpoint the type and severity of the deformity. They'll also look for any twisting by comparing how the elbow and the wrist are oriented relative to each other.
Okay.
For really complex cases, maybe where surgery is being planned, advanced imaging like CT scans can be incredibly helpful.
CT scans.
Yeah, computed tomography. It gives a much more detailed 3D view of the bones and joints. Sometimes vets even use the CT data to create 3D printed models of the bones to plan the surgery more precisely.
Wow, that's quite advanced. And it sounds like vets are also looking for other potential problems at the same time during this diagnostic process.
Exactly. It's essential to also evaluate the elbow joint very carefully for other common developmental issues, especially things like an ununited anconial process or UAP and a fragmented medial coronoid process or FMCP.
Because those can cause similar signs like lameness?
Precisely. They often occur concurrently with growth deformities, especially in certain breeds, and they can also cause significant lameness and joint pain. Plus, the presence of any existing wear and tear in the joints, what we call degenerative joint disease or osteoarthritis, that also needs to be assessed, as it heavily influences the treatment plan and the long-term outlook.
Okay, so diagnosis is a really thorough, multifaceted process. Let's move on to treatment. Once a growth deformity is diagnosed, what are the options? What can be done?
Right, treatment. Well, first thinking bigger picture, particularly for those breeds where these conditions are known to be inherited. The most important step, really, is prevention for the future. And that means avoiding breeding affected animals. That's crucial to reduce the incidence over time.
Makes sense. Don't pass it on.
Exactly. Now, for an individual animal, especially if the cause is trauma leading to growth plate damage, even if it's not immediately obvious, surgical intervention is generally recommended. And usually, the sooner the better.
So timing is key.
Very key, especially in young animals, say, typically under 6 months of age, who still have a significant amount of growing left to do. Early surgery aims to correct the deformity before it becomes too severe and causes irreversible joint damage. It's also important for owners to understand that sometimes, depending on the complexity and the age, more than one surgery might be necessary over time.
Okay. And what do these surgical procedures typically involve, without getting too technical?
Sure. A common approach involves what are called osteotomies. Essentially, yes, controlled cuts made in the bone, or bones, to correct the abnormal angles and any twisting. These cuts are then stabilized, usually with metal plates and screws, or sometimes external fixators. Those are the metal frameworks you sometimes see on the outside of a limb.
Right.
The surgery, the osteotomy, is usually performed right at the point where the bone shows the most curvature or deviation.
And what about correcting that joint misalignment we talked about earlier? The elbow or the wrist not lining up?
That's a critical part of the surgical goal. Getting the joints properly aligned, especially the elbow, is absolutely essential to minimize the long-term risk of arthritis.
Because the arthritis is the main source of chronic pain, right?
Exactly. So techniques might include something called a dynamic proximal ulnar osteotomy, which kind of cleverly uses the pull of the triceps muscle to help realign the joint after cutting the ulna. Or in some cases, it might involve simply shortening the longer of the two bones, cutting a piece out of the radius or ulna to make them match length again.
Okay. And what if there's a really big difference in limb length?
Ah, yes. In cases where there's a significant limb length discrepancy, maybe more than 20% difference, a more complex procedure called distraction osteogenesis might be considered.
Distraction. Osteogenesis.
Yeah, it means bone creation by pulling apart. Basically, the surgeon cuts the shorter bone, applies a special external fixator, and then over several weeks, the fixator is gradually adjusted to slowly pull the bone ends apart. New bone fills in the gap.
Wow, so you're actually lengthening the bone.
Exactly. It can achieve significant lengthening, but it's a long process, requires a lot of aftercare, and does have a higher potential for complications.
Okay, those sound like pretty major interventions. Are there situations where surgery isn't the best path? What are the non-surgical alternatives?
Yeah, non-surgical management or conservative management is generally reserved for maybe milder cases where the deformity isn't causing significant lameness or joint issues yet, or perhaps when surgery isn't a viable option for the owner, maybe due to the pet's health or financial constraints.
Right, what does that involve?
It might involve things like restricting exercise, avoiding high-impact activities to try and protect the joints, and slow down the progression of arthritis. For giant breeds, managing their diet carefully to avoid excessive growth rate and keeping them lean is really important. Pain management is key too. usually using non-steroidal anti-inflammatory drugs, NSAIDs, to help manage the discomfort associated with the inevitable osteoarthritis. Long-term use of corticosteroids, though, is generally avoided because of potential side effects.
What about supplements, like glucosamine?
Sometimes, yes, joint supplements containing substances like glucosamine and chondroitin sulfate are often used. The aim is to support cartilage health and potentially slow down degeneration.
Do they work?
Well, the scientific evidence for their effectiveness is still somewhat debated, honestly. Some studies show benefit, others don't. But they're generally considered safe. So many vets and owners feel they're worth trying as part of a multimodal approach.
Okay. This really highlights how important the conversation between the owner and the vet must be. What are the absolute key things pet owners should take away from all this? What's the crucial client education piece?
Client education is absolutely paramount here. It's vital for owners to understand the potential for these conditions to be inherited, especially if they have a susceptible breed.
Right.
Also, really hammering home that point about delayed consequences, that even seemingly minor injuries during growth can lead to problems weeks or months later,
Yeah, that's a big one.
and emphasizing that it's usually the resulting joint misalignment and the subsequent osteoarthritis that are the primary drivers of lameness and chronic pain, not necessarily the crooked look of the bone itself.
Okay.
And finally, stressing that early surgical intervention, when appropriate, generally offers the best chance for a good long-term outcome, but also being realistic and preparing them for the possibility that sometimes multiple procedures might be needed, especially in complex cases or very young animals.
That's really helpful context. So, thinking about the long run, what can owners typically expect for their pets? What's the overall prognosis like?
Generally speaking, the outlook, the prognosis, is better when the problem is diagnosed and treated early.
Before significant arthritis sets in.
Exactly. Early intervention helps minimize the severity of that degenerative joint disease. Anecdotally, and as mentioned in the text, premature closure of the ulna often tends to be a bit easier to manage surgically and may carry a slightly better prognosis than similar issues primarily affecting the radius.
Interesting.
But overall, the prognosis really depends on several factors.
Yeah.
How severe was the initial deformity? How well can the joints be realigned surgically? And is there already significant arthritis present at the time of diagnosis or surgery? Those are key determinants.
And what about that limb lengthening procedure you mentioned?
Right, distraction osteogenesis. While it can be very effective for correcting major length discrepancies, it definitely carries a higher risk of complications. Things like pin tract infections, delayed bone healing, joint stiffness, and it requires a really significant commitment from the owner for aftercare over several months. So the prognosis there is often more guarded.
Okay, good to keep in mind. Finally, are there any concrete steps owners can take to potentially prevent these issues from arising in the first place?
Well, for the genetic component, prevention really comes down to responsible breeding practices.
Screening breeding animals.
Ideally, yes, and certainly not breeding animals known to be affected or that have produced affected offspring, especially in those predisposed breeds. That's the biggest impact we can have on the inherited forms.
And for the other causes, like nutrition.
For nutrition, particularly in those rapidly growing large and giant breeds, the key is balanced nutrition. Avoid excessive supplementation, especially calcium and phosphorus, beyond what's in a high-quality, balanced commercial puppy food designed for their size and growth rate. Feeding for a lean body condition and avoiding overly rapid growth is generally recommended for overall skeletal health.
Makes sense. Balanced approach.
Exactly.
Okay, let's try and wrap things up. If you had to distill it down, what are the most important things you want our listeners to remember from this deep dive into antebrachial growth deformities?
I think the key message is that these are complex developmental issues. They have a range of potential causes where both injuries, even minor ones, and genetics can play really significant roles.
Right.
And because of that complexity, early detection by observant owners noticing those subtle changes.
That slight limp, the odd angle. Precisely. And then timely intervention by veterinary professionals are absolutely critical for achieving the best possible outcomes. It's all about minimizing that long-term impact on joint health and mobility. Understanding just how delicate and precisely orchestrated normal bone growth is really underscores why any disruption can lead to such a variety of problems.
This has been a truly illuminating discussion. It really does make you appreciate the incredible, intricate processes involved in a young animal's growth, doesn't it?
It really does.
So here's maybe a final thought for you, the listener, to consider. Given just how precisely timed and balanced the growth of these bones needs to be, What other, maybe seemingly small factors in a young animal's environment, or perhaps even their activity levels, might unexpectedly influence their development in ways we don't fully understand yet?
Hmm. That's interesting to think about.
It certainly gives you some food for thought when observing your own furry companions grow up. Of course, if you do have any specific concerns about your pet's limbs or how they're moving, remember this deep dive provides a solid foundation. But we always encourage you to seek out reliable veterinary information and, most importantly, have that conversation with your own veterinarian.
Absolutely. Early consultation is key.